In this video, I will talk about another clinical syndrome called Nevoid Basal Cell Carcinoma syndrome. Other names of Nevoid Basal Cell Carcinoma syndrome are basal cell nevus syndrome, gorlin-goltz syndrome, Gorlin syndrome, Hermans-Herzberg phacomatosis. The students will learn about the causes, clinical features, and management of this syndrome. Fortunately, Nevoid basal cell carcinoma syndrome is not very common. It is a genetic disorder that is characterized by multiple developmental defects and a tendency to develop a type of skin cancer known as basal cell carcinoma. NBCCS was first identified in 1894 by two physicians, Dr. Robert Gorlin and Dr. Rodent-ulcer. However, it was only in 1960 that the syndrome was recognized as a separate clinical entity. In recognition of the services of these two physicians, NBCCS is known as Gorlin syndrome or gorlin-goltz syndrome. Causes. NBCCS results from a mutation in the PTCH1 gene, which is a tumor suppressor gene. In some cases, there is a mutation of the PTCH2 gene, or some have been found to have mutations in the SUFU gene. Both of these genes have a similar role as PTCH1 to control cell growth and development. NBCCS is an autosomal dominant disorder, and the abnormal gene can be inherited from either parent. There is a 50% chance in each pregnancy to transmit a defective gene from the affected parent. Males and females are equally vulnerable. In 35 to 50% of the cases, a new mutation is responsible for the NBCCS and there is no defective gene inheritance from the parents. A complete penetrance, that is, all individuals who inherit the defective gene will develop the syndrome, is a characteristic feature. NBCCS also demonstrate variable expressivity, which means wide variations in the clinical manifestations among the patients. Exposure to ultraviolet light and ionizing radiations play an important role in the development of basal cell carcinoma in cases of NBCCS. The symptoms and signs of NBCCS vary from person to person. Disease course ranges from mild to severe with significant complications. Multiple organ systems in the body may be affected. The most peculiar lesion is basal cell carcinoma, occurring as a differently colored skin lesion that may be flat or nodular. These may be few or many, ranging from 1 mm to 10 mm in size. The sun-exposed areas are prone to developing these lesions, including the face, neck, and chest. BCC tends to occur in younger adults, but any age can be affected. Distant spread is rare, but local invasion may occur as the tumor becomes aggressive in some cases. Jaw cysts involving the mandible mostly, which are keratocystic odontogenic tumors, may be the first manifestation. Jaw cysts are usually painless but may become aggressive and cause pain, fractures, and loosening of teeth. Hardening of some areas of the brain, such as the falx cerebri, may be found due to calcification. Other areas of the brain may be affected as well. This is usually not associated with any symptoms. Multiple small pits on the palms and the soles, skin tags, and epidermal cysts may be present in the affected individuals. Individuals having NBCCS exhibit an overgrowth syndrome characterized by a large head, that is macrocephaly, and these individuals are taller, which is inconsistent with their age. Abnormal facial features include frontal bossing, that is bulging forehead, hypertelorism, that is widely spaced eyes, and facial milia, which are small white nodules or cysts on the skin. Rarely cleft palate or cleft lip, microphthalmia, cataracts, nystagmus, squinting of eyes, or coloboma may be present. Coloboma is a partial absence of tissue from the iris or retina. Skeletal abnormalities may be found in cases of NBCCS, such as fused or absent ribs, scoliosis, polydactyly, multiple toes and fingers, or syndactyly, webbing of toes and fingers, and sprangial deformity. In sprangial deformity, there is an elevation and or underdevelopment of the scapula that limits the movement of the arm on the affected side. Pectus carinatum, sunken chest, or pectus excavatum, chest protruding outward, may be present. Some patients may have spina bifida with or without hydrocephalus. Only a few NBCCS cases may develop medulloblastoma, which is a malignant brain tumor usually occurring at a very early age. The risk of developing cardiac fibromas, meningioma, ovarian fibromas, and rhabdomyosarcoma is more in individuals affected by NBCCS. Polyps or cysts may occur in different parts of the body, including bones, bronchi, intestines, and the peritoneum. In some patients, intellectual incapacity, seizures, middle ear defects, renal anomalies, absence of the internal carotid artery, and anosmia may be found. Complications which are most commonly associated with basal cell carcinoma are disfigurement, infection, ulceration, and bleeding. Differential diagnosis includes Beckwith-Wiedemann syndrome, Sotos syndrome, Banayan-Riley-Ruvalcaba syndrome, Bézek's syndrome, Muir-Torre syndrome. These syndromes may have the skull and facial deformities along with physical and mental developmental defects similar to NBCCS. Basal cell carcinoma may be present in some of these syndromes. There are specific features related to these syndromes, and those help in distinguishing the clinical condition. Diagnosis depends upon the identification of 2 major and 1 minor criterion, or 1 major and 3 minor criteria related to NBCCS. In the first column of the slide, you can find the major findings, whereas the second column shows the minor signs and symptoms. So any of the 2 major and 1 minor criteria or 1 major and 3 minor criteria confirms the diagnosis of NBCCS. Battery of tests include magnetic resonance imaging, which may reveal calcification of the falx cerebri, abdominal ultrasound, which can reveal mesenteric cysts, skeletal survey to demonstrate skeletal defects, X-rays of the jaw bones, an echocardiogram to find out cardiac fibromas and to study cardiac function, an ovarian ultrasound to check for ovarian fibromas, molecular genetic testing to confirm the diagnosis of NBCCS. Symptomatic treatment is required for NBCCS. A team of specialists including pediatricians, dermatologists, oral surgeons, dentists, cardiologists, ophthalmologists, and plastic surgeons make a treatment plan for an affected individual. Genetic counseling is advised for the affected individuals and their families. Surgical excision of tumors is required. BCC can be treated in many ways, such as surgical excision, cryotherapy, topical creams, photodynamic therapy, and laser. Now, how to prevent NBCCS? Affected individuals should avoid excessive exposure to ultraviolet light by using sunscreen and sunglasses. Avoid exposure to ionizing radiations. Tumors and cysts in any area of the body should be managed promptly to prevent complications, and full screening for NBCCS should be performed in these cases. Affected individuals should be screened with a panoramic radiograph annually from the age of 8 to detect odontogenic tumors of the jaw. Regular dermatologic consultations for small skin lesions prevent disfigurement and severe complications of BCCS. Head circumference and physical growth monitoring along with screening for medulloblastoma in the early years of life in suspected cases are highly recommended. Thank you for listening. If you like the video, make sure to drop a like. Let me know if you have any suggestions in the comments below.